So what does this mean? A CBC is basically a measurement of white blood cell count, right? Hemoglobin count, hematocrit count, and platelets. When we see a CBC with diff, that means a differential, right? We think you have an infection, and now we want to know how much neutrophils you have as a percentage. How much eosinophils? How much basophils? Not as much of those, not quite as worried. But how many lymphocytes? That's important. And monocytes. Right? So what we do is when we do a CBC, part of it is seeing if you are carrying enough oxygen. So we're going to see, right, hemoglobin tells you if you have enough hemoglobin, right? The more hemoglobin, the more oxygen carrying capacity. So hemoglobin is your O2 carrying capacity. We kind of wrote those numbers before, 14 to 18 in males, right? 12 to 16 in females. Your hematocrit basically is the amount of formed elements that we have in your whole blood, right? 46 to 48% in males, 44 to 46 in females, right? So this tells us, do we have enough red blood cells without really going in and doing a red blood cell count, right? So the weird thing is this, there are some anemias where the hemoglobin count is very low, but the hematocrit is normal, right? This is what we see in pernicious anemia. What happens in pernicious anemia is that you're not getting enough vitamin B12. You make red blood cells, but the red blood cells are slightly mutated. It doesn't carry oxygen. Because you make red blood cells, your hematocrit count is normal. But when we look inside the red blood cell, because it's not normal, the hemoglobin count is abnormal. So you have low hemoglobin, but high amount of red blood cells or hematocrit. What happens? You're still anemic. Anytime your hemoglobin levels is low, you have anemia of some kind. Now, your WBCs should be between 10 to 15,000, much lower than your red blood cells, right? When your WBC count increases to about 20,000, we know you have an active infection. Now I want to figure out, all right, you're not feeling well, your child isn't feeling well, how can we treat it? Would it be better to give you an antibiotic right away? But you guys know now we're very kind of stingy in prescribing antibiotics because of drug resistance. So we want to make sure if I'm giving you antibiotics that I do think it's for a bacterial infection, right? It takes days for you to culture. And for the actual bacterium, if it's present, right, it takes days for the bacterium to actually seed and we can grow it in the agar, right? So in other words, mom, right, who's had a crying baby for the last week, and now the baby starts moving the ears, they think she has an ear infection, cough and a cold. You try to tell that mom that, yeah, we're gonna wait 48 hours to 72 hours before we'll prescribe antibiotics. Most parents don't like that, right? Especially if the baby is already very sick. So what we can do is do the differential and look to see if this value is increased. Normally, neutrophils are pretty high already. So when you take a look at the neutrophil count, you see I have it right here. The neutrophil count, we're talking about, you know, the vast majority of your white blood cells are neutrophils. Sorry. Vast majority are neutrophils. So which ones are neutrophils? Right here, 60 to 70%. Normally, it's already 60 to 70%. Now, if that value goes over 70, towards 75%, 80%, we know is most likely going to be a bacterial infection. At that point, I have enough clues to give you a broad spectrum antibiotics. If that value goes downwards and becomes 55, 57%, but this value for lymphocyte increases, what happens is it's most likely not going to be a bacterial infection. It's going to most likely be a viral infection. Give you antibiotics will not help anyways. This is why we do a CBC with diff. On this side, we see platelets, and it's about 400,000 is a number. Now, if your platelet levels are low, you have a harder time forming clots. Questions? Now let's take a little break. Come back.